General Principle of Intensive Care Management. What is ICU? بداية رح نوضح شنو ال ICU. Is a specialized area containing care for the sick patient in the hospital in one place. Is staffed by multidisciplinary team of the doctor, nurse, physiotherapists, and detains among others who combine treatment with the constant patient observation, monitoring, and support. 3. Has the equipment and medication required to provide multi-organ support. 4. It should be close to operating their emergency department and radiology service. Size 6 إلى 20 beds and is the 2 إلى 20 personality of total hospital beds. 2. Commonly have many patients in the large open area. 3. If you separate a room of infected patient. 4. Device in the ICU ventilators, hemofiltration or hemodialysis, monitoring infection and syringe pumps, machine for blood gas analysis. A large amount of space is required for storage of equipment including gas cylinders, disposable products, drug, laundry, chairs for patient and visitors, clean and dirty utility areas and flagels for disposal of rubbish. Visitors should have a waiting area, quiet interview room for discussion with family members are essential. The staff, multidisciplinary team led by consultants, intensivists. The referring doctor should visit the unit regularly and consult their patient management. While in the unit, the patient are managed hour by hour by the invested. Trainee doctor will also be present in the unit 24 hours a day, usually at a ratio for 1 for every night bed. Nurse working in critical care require the skill necessary to care for severely ill patients. In the United Kingdom, the nurse-patient ratio is usually 1:1 for intensive care and 1:2 for high dependency care, compared to the ratio for between 1:6 and 1:10 general ward. Other members of the multidisciplinary team include physiotherapists, pharmacists, dietitians, microbiologists, ward clerks, data clerks. Important input comes from other groups including the radiology and pathology. The patients in the ICU are the sickest in the hospital. They will have at least one organ system that are failing and needing support. About 50% of admission are due to a surgical causes. Many of these patients will be admitted immediately after major elective surgery. The remainder will have a medical diagnosis and be referred from either the emergency department, general wards for department, or transferred from other hospital. ICU dismissal is expensive and should be reserved for patients who can recover on obvious expression in for patients who are potential organ donor. About 20% of ICU patients will die. Interventional treatment withdrawn after detailed discussion with the college and family members. ICU patients also need other care including adequate nutrition, pressure area care, thrombolysis embolic and stress will clear prophylaxis, oral hygiene, and physiological support. Much of this is provided by the nurse caring for the hospital. Is the important to avoid transmitting infection between patients by good hygiene techniques. Relatives. Most ICU unit was an open vesting policy. The ICU farting environment, so the person for familiar face and voice can be beneficial to a patient, as critically ill patient might be limited in their ability to make or communicate diagnosis about their treatment. It is usual to ask relative what choice the patient would likely have made had they been able to do so.